Good morning, everybody, or good afternoon for those who aren't on this coast, which I'm usually not. It was very exciting for me to wake up at 5 a.m. this morning, my time. So I thought I'd start today with the Robert Wood Johnson Foundation's vision for the future. And it's that we as a nation will together create a culture of health, enabling all in our diverse society to lead healthy lives now and for generations to come. And I want to make clear that this is a vision that the Foundation has been working on, but it's not a vision that we can execute alone. And I love this vision, in part because it really speaks to me as an individual, and I hope it speaks to you. It shows us that health is the outcome, that what we're really talking about here is how we can build upon health for ourselves, for our families, and for our communities. And I want to point out that foundations can play a unique role in bringing this vision to life. I agree completely with Marshall that foundations can't direct a movement, but we can play a role in it. We can shape the dialogue, we can build demand for change, and we can make direct investments to help those folks who are already mobilizing and organizing to push towards those policy changes that we all seek. Because when these are applied together, they actually do come together to create those public expectations about health. So for shaping the dialogue, as we think about it, there are several things we need to do. We need to get the public engaged. We need to think about how we support existing organizations and networks, like Moms Rising, which is really about engaging mothers in the things that they care about for their families, whether that's health, housing, jobs, education, but really thinking about how we engage them. We need to think about research, how we frame and communicate critical issues. And this came up several times through our morning discussion already about how we make health matter to us, how we actually think about it for ourselves and see ourselves in this collective vision. We need to provide clear, accurate, and usable information, and we need to understand what individuals and communities want. And for this last point, I want to underscore it because there's a real opportunity here around marketing analysis and big data, which I think many of us have heard about, to truly understand what individuals want and need and what excites them and what motivates them to take action. As Marshall talked about, it's not enough to mobilize people for a moment. We actually want to mobilize, organize, and activate people so that they are all working towards something together. And I think that this is especially important for today's discussion, given the growing diversity that Mildred talked about, but also the growing disparities that we have in this nation. Because if we really want to empower people and we want them to take part in creating the society that we hope for, we have to help them see where they fit, and we have to listen to them and understand how we can help create that demand for change. So I also listed building demand for change. And so what's essential here? Building, connecting, and leveraging our networks. So that's really thinking about how we bring together organizations, people, leaders, the elites. But more importantly, at least from the path that I come from, is about how you engage the community. Because we're all involved in different parts of a network. We're either engaged in our PTA, moms groups, in our professional organizations, in our churches, and those are all networks that we can bring to bear to create and learn from each other and share. The second is highlighting success and innovation, and then engaging and influencing the action of others. And I intentionally point out the action of others, and you might be saying, what others? Maybe that's me. I think often in health, we talk to ourselves. But as you heard earlier this morning, it's really important for us to be thinking about how we engage education, transportation, housing, business leaders, because this is really what they are building their communities on and where they're drawing their workforce from. And so it's important to engage them And it'll also lead us to having more influence, but I'll talk more about that in a minute. So I have 3 examples I want to share with you. One is tobacco control, where we're coming up on the 50th anniversary of the first Surgeon General's report on tobacco, and that is incredible work that was done. And it shaped the national dialogue on tobacco use. It connected for the first time the science to the idea that people's minds needed to be changed. As recall, and some of you may be too young to remember this, smoking was acceptable. Doctors were promoting the use of different tobacco products. And this was the spark. What this report did is it sparked the demand for change, and over the years galvanized networks of individuals working in communities across the country to change our laws and ultimately change our culture. I think for many of us it's even difficult when we go someplace now and there isn't a smoke-free law. We actually are surprised and think, what happened here? The second example I want to share with you is childhood obesity, where we've recognized we had a problem, and it was a growing problem. And over the last 10 years, we've been able to build the evidence for what works, and we brought people, organizations, and networks together to address not only the individual needs, how do I lose weight, what can I do to eat better, how do I be more active, but also focused in on putting policy approaches in place to help people and their families live more active lives and reduce obesity rates. And I think that policy change is critical and should be a theme that you're hearing throughout the conversations today. And lastly, around childhood obesity, we're seeing signs of progress across the country from all kinds of communities attending to all kinds of populations. And that's important for us. Now, for both tobacco and obesity, I'm not suggesting that we're done on either of these. As we talked about already this morning, they're long fights, and there's always more work that we can do. But I want to stress that there's progress here. There's innovation, there's success that we can build on to do what Francesca talked about, which is knit issues together to create a broader movement towards a culture of health. Which leads me to my third example, which is the county health rankings. Arguably, this is one of the Robert Wood Johnson Foundation's most visible programs. It ranks the health status of each county in the nation and includes the factors that contribute to health, as you see here, like healthy behaviors, tobacco use, obesity, clinical care measures, access to care, quality of care, the social and economic factors, education, employment, and environmental factors. Now, I should say, while we've been doing the rankings for about 7 years now, we actually started to do work on how to talk about the social determinants of health, those factors that influence health, for about 3 years before we put this project out. Because it was important that we could talk about it in a way that everyone could understand why housing made a difference to my life in terms of my health, why education made a difference in my life. Now, scorecards like the county health rankings have brought a lot of attention to the factors that influence health, and more importantly, I think, to the places that are doing well and those places that need to improve. And we really see these scorecards as highlighting successes, highlighting innovations, but we also see it as an opportunity to tell the stories and give awards, because those are powerful strategies that get people excited when they can see that while they can't fix all of their challenges like that, they can make progress and help to move forward. And we do think about this model as a platform. And when you, in system science, they talk about a platform as a structure that brings networks together. And I'll give an analogy that I stole from my boss, which is that of a shopping mall as a platform. It brings together networks of shops in one space and a group of shoppers. And there's advantages to both groups, right? To the shops, it's shared overhead and lower utility rates and more customers. To the customers, it's parking, covered shopping space, and more variety. Well, the county health rankings we see as a platform for the culture of health because it brings together leaders who are interested and concerned about the various elements of the rankings, connecting them to other leaders from various segments of the population, like hospitals, park and recreations, local government, schools, business, law enforcement, community developers and funders like the United Way, who all care about the communities they're a part of, but they don't often work together or see their issues as having shared or common opportunities. The rankings actually provided that opportunity and that stimulus for a conversation, and we're happy to say more action. Which leads me to my last point around influence. That in order to influence the actions of others, we need to think about how we build relationships with these different sectors. The nature of our engagement with them has to expand so that we're not just thinking about what they can do for us and why can't they understand the issues that I care about. I don't understand why they don't get it. But we need to be asking ourselves how we can become an influential contributor to their goals, to the strategies that they're pursuing, and where are those opportunities for us to work together? Where can we bring ideas and innovations from their sector, whether it's education or business, back into the movement that I'm a part of, and that they see themselves as being a part of? How can we share credit with them so that we're not being co-opted, which is an issue that came up earlier, but that we're actually making sure that when there is an opportunity for us to work on a shared issue together, we're taking advantage of that, and we're acknowledging each other, and we're raising the visibility of the solutions that we came to together. These are really important pieces for us to think about as we start to build this broader movement. Now, I don't know about you, but sometimes when I think about this, I feel like it's daunting. But then I think back on the multitude and the large array of movements that have happened in this country, from civil rights to gay marriage to childhood obesity to seatbelts and injury prevention. And it doesn't seem that difficult for us to picture a place where we can knit our issues together and do a better job as a nation of creating that culture of health. Because I do believe that culture of health is a compelling vision for our nation, and that we need to connect this vision with the dreams and aspiration of individuals, again, for their families, for themselves, for their communities. If we can't connect it to them, we'll miss out on great opportunities. And we do need to build that broad sector of engagement, that partnership, that commitment. And I think if we do that, we can start to do a better job at doing what Marshall talked about, which was how do we actually track our progress and make sure that we're being concrete in not only meeting what we believe are our targets, but what our partners in that movement also do. So it'll take time to get there, but I'm excited for this journey, and I really hope that we will be more and more creative about how we find and solicit and engage and influence allies, because this is a heavy lift, and it matters to us. It matters to me, it matters to my family, and I hope it matters to you, and I look forward to the conversation.
Thank you, Michelle. It's my pleasure to introduce Joan Twist, who is the Executive Director of the Center for Civic Partnerships. Joan and I have been colleagues working in building healthy communities for many years, and I look forward to what you have to share with us. And again, just to let folks know, we'll probably go into some of our question and answer time, so if the rest of the panelists can stick to the yellow and red light, I'd appreciate it.